Hello students, in today's video we are going to study pharmacology of another class of anti-cancer drugs, that is the anti-tumor antibiotics. Now as we all know, cancer is a disease that is caused by the rapid, abnormal, uncontrolled multiplication of the cells. Now anti-tumor antibiotics possess prominent anti-tumor activity, and these are cell cycle non-specific drugs. Anti-tumor antibiotics that we are going to discuss here are Actinomycin D, also known as Actinomycin, then doxorubicin, daunorubicin, also known as rubidomycin, then epirubicin, MitoEntron, Bleomycin, and Mitomycin C. Now let's first understand general mechanism of action of anti-tumor antibiotics. So look at these two figures. This is a normal DNA and this is an intercalated DNA. Now as we all know, DNA is made up of nucleotides, and each nucleotide is made up of deoxyribose sugar, nucleobase, and a phosphate group. Now the two strands of DNA are linked primarily through a hydrogen bond between the complementary nucleobases. Now anti-tumor antibiotics intercalate between the DNA strands. Now intercalation is a type of non-covalent interaction with the DNA. So we can say that these antibiotics, they are inserted between the DNA base pairs. So see here, this is one DNA base pair, and this is another DNA base pair. An anti-tumor antibiotic gets inserted between the DNA base pairs. So this is intercalation. Now this intercalation causes structural changes in the DNA, and this intercalation interferes with the template function of DNA. So the DNA cannot replicate, then transcription is also prevented, so RNA is not synthesized, proteins are not synthesized, and this results in the functional arrest. That is, the cell multiplication and proliferation stops, and the cell undergoes apoptosis or programmed cell death. So this is the mechanism of action of anti-tumor antibiotics. So these antibiotics gets intercalated between the DNA strands. Now let's discuss pharmacology of each anti-tumor antibiotic. Now first antibiotic is Actinomycin D, also known as Actinomycin. It is given intravenously. Now Actinomycin D intercalates between DNA strands, and as we have already discussed, this prevents DNA replication, and it also prevents transcription, and therefore there is inhibition of RNA synthesis. Now this antibiotic is highly effective in Wilms tumor, then childhood rhabdomyosarcoma. Then it is also very effective in methotrexate resistant choriocarcinoma, then Ewing sarcoma, and metastatic testicular carcinoma. Now main adverse effects are vomiting, stomatitis, that is inflammation of the oral cavity, diarrhea, then erythema, then desquamation of skin, that is peeling of the outermost layer of the skin, alopecia, and bone marrow depression. So this is the pharmacology of Actinomycin D. Now next type of anti-tumor antibiotics are Anthracyclin antibiotics. Now here we are going to discuss 4 Anthracyclin antibiotics, namely daunorubicin, then doxorubicin, then epirubicin, and MitoEntron. All these Anthracyclin antibiotics are given intravenously, and all Anthracyclin antibiotics intercalate between DNA strands, and thereby this causes inhibition of DNA replication and RNA transcription. These antibiotics also activate enzyme topoisomerase 2. Now, as we all know that during DNA replication, topoisomerase II cuts both DNA strands, removes supercoils, and then reseals the cut DNA strands. Now, activation of topoisomerase II produces breaks in the DNA strands. Now, in addition to this, in the presence of oxidoreductive enzymes and iron, the quinone portion of anthracyclin antibiotics undergoes redox reaction, and this causes generation of free oxygen radicals. Now, excessive generation of these oxygen radicals damage the cell membrane, proteins, lipids, and it triggers the cell apoptosis, that is programmed cell death. So, this is the general mechanism of action of anthracyclin antibiotics. Now, daunorubicin and doxorubicin, they possess the same mechanism of action. Now, use of daunorubicin is limited to acute myeloid leukemia and lymphoblastic leukemia, while doxorubicin, in addition to these leukemias, is also effective in solid tumors like breast, thyroid, ovary, bladder, and the lung cancer. It is also effective in sarcoma and neuroblastoma. Now, let's study toxic effects of daunorubicin and doxorubicin. Now, anthracyclin antibiotics produce cardiotoxicity. Now, daunorubicin and doxorubicin cause acute toxicity as well as delayed cardiotoxicity. Now, acute cardiotoxicity is exerted within 2 to 3 days after the administration of drug, and this acute toxicity causes changes in the ECG. It can also cause hypotension and arrhythmia, but all these changes are reversible. Now, delayed cardiotoxicity can cause dose-dependent congestive heart failure. Now, this congestive heart failure occurs because of the cardiomyopathy, that is because of the diseased heart muscles. Now, this congestive heart failure can be fatal also. So, the main toxic effect of daunorubicin and doxorubicin is the cardiotoxicity, which can be acute toxicity or which can be a delayed toxicity. Then other side effects are bone marrow depression, alopecia, stomatitis, vomiting, and tissue damage on extravasation, that is after the injection of these antibiotics, and urine discoloration can also occur. The color of urine can change to red. So, these are the adverse effects of these antibiotics. So, this is a pharmacology of daunorubicin and doxorubicin. Now, another recently introduced anthracyclin antibiotic is apirubicin. Now, its mechanism of action is similar to doxorubicin, and it is primarily used as a component of regimen for adjuvant therapy of breast carcinoma. And other indications are gastroesophageal, pancreatic, hepatic, and bladder carcinoma. Now, as it is an anthracyclic antibiotic, it also produces dose-related cardiotoxicity, and other adverse effects are alopecia, then hyperpigmentation of skin and oral mucosa. It can also cause production of painful oral ulcers, fever, and gastrointestinal symptoms. Now, in addition to this, there can be urine discoloration, and the color of urine may change to red. So, this is the pharmacology of apirubicin. Now, another anthracyclin antibiotic is MitoEntron. Its mechanism of action is similar to doxorubicin, but it does not produce the free radicals. Now, its use is restricted to acute myeloid leukemia, and it is also useful in advanced refractory prostate cancer. That means in advanced prostate cancer which is not treated by other drugs, other anti-cancer drugs. And occasionally MitoEntron is used in breast and hepatic carcinoma, then non-Hodgkin lymphoma. It is also useful in late stage multiple sclerosis. Then toxicity of MitoEntron. Now major toxicity is the bone marrow depression and mucosal inflammation. It can also cause discoloration of eyes and nails. So this is the pharmacology of MitoEntron. Now the next antibiotic is Mitomycin C. Now Mitomycin C is also administered intravenously. Now it is intracellularly transformed to a form that acts like an alkylating agent. That means within the cell, mitomycin is transformed, and that transformed form acts like an alkylating agent. Now, as we have already discussed the mechanism of action of alkylating agents, it forms this transformed Mitomycin C, it forms cross linkages between the DNA strands. Now, because of the formation of cross linkages between the DNA strands, this prevent DNA replication and transcription. Therefore, RNA is not synthesized. Now, in addition to this, Mitomycin C also generates free radicals that further damages the DNA, and this triggers cell apoptosis. Now, mitomycin is a highly toxic drug, and thus it is used only in resistant cancers of stomach, cervix, colon, rectum, breast, etc. And here it is usually used along with 5-fluorouracil and radiations. Now, in addition to this, it is also useful in the superficial bladder tumours. Now, here mitomycin C is administered by the intravesical route. That means here the mitomycin C is administered with the help of a catheter in the urinary bladder. Now, the primary toxicity of mitomycin C is the bone marrow suppression and gastrointestinal tract toxicity. It can also cause hemolytic uremic syndrome, where small blood vessels in the kidney, they get damaged and they also get inflamed. So this is the pharmacology of mitomycin C. Now, another antibiotic is the bleomycin. Now, bleomycin is given intravenously or intramuscularly. Now, bleomycin forms chelates with copper or iron, and it produces superoxide ions, that is free radicals, and these free radicals break the DNA strands, and it also intercalates between the DNA strands, thereby preventing DNA replication and transcription. So this triggers the apoptosis, that is programmed cell death. Now, bleomycin is highly effective in testicular carcinoma, then squamous cell carcinoma of skin, oral cavity, head and neck, then genitourinary tract and esophagus. It is also useful in Hodgkin lymphoma and malignant pleural effusion. Now, specific toxicity of bleomycin is pulmonary fibrosis. Other toxicities are mucocutaneous toxicity. It also produces myelosuppression, but that is very minimal, that is very less with the bleomycin compared to other anti-cancer drugs, and injection of bleomycin can cause allergic and hypotensive reaction. So this is in brief on the pharmacology of anti-tumor antibiotics, a class of anti-cancer drugs. Please note that the information provided in this video is only for informative academic purpose. For use of any of these drugs or for the treatment of cancer, consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.